Hi, my name's Dr. Sarah Moore and I'm an integrative GP obstetrician. Welcome to my pregnancy series. In this series, I'm going to cover off on 6 stages of pregnancy. And the first one that I'm going to talk about is preconception. And I'm going to give you the top 5 tips for planning your pregnancy. So in this video, I'm going to go over the lifestyle factors that you might need to modify when you're trying to fall pregnant. I'm going to go through the medical review that your GP would do when you book in for a preconception planning visit. I'm going to run through the screening tests that we would use to identify any important medical issues that might need addressing before you fall pregnant. I'm going to talk about the importance of taking folic acid. And I'm also going to cover off knowing when the fertile time of the month is for you. So to begin with, let's talk about the lifestyle factors that you may need to consider. So importantly, diet, sleep, exercise, stress, toxins, your relationships, your work, and your spirituality. So there's a lot of resources available for each of these topics on my blog, and I would encourage you to visit my website, drsarahmoore.com, for a more detailed explanation on how to optimise your lifestyle as you prepare for your pregnancy. I do like the Ayurvedic approach, which is really basically making the mother feel like a princess. Pregnancy is a really important time, and it's important that a mother is protected and nurtured while she grows a baby. And so the Ayurvedic approach really focuses on making life as easy and as peaceful as possible for the mother. So when you book in to see myself or another GP for a medical review, you're going to be asked about a number of medical issues, and they would include your mental health history, any medications that you might be taking, your family history, and any particular genetic conditions that might be of concern for you. We'll also talk about your social history, and that includes your occupation, any alcohol or drug use, that includes smoking, and any stressors that might be impacting on your ability to conceive and to maintain a pregnancy. In terms of blood testing, we would talk about screening you for rubella, or looking to see if you're immune to rubella, and screening for other infections like hepatitis B, HIV. We would look at your thyroid function, your iron levels, and your vitamin D levels. So all of those things are important to optimise before you fall pregnant. In terms of folic acid, the reason that we suggest supplementing with folic acid is to prevent spina bifida, which is a neural tube defect that can occur if your folate levels aren't high enough. So the standard dose is 500 micrograms daily, and we do recommend that you take that for at least 3 months before conception. There are a few conditions where we encourage you to take a higher dose, for example, if you are on medication for epilepsy. So finally, just knowing when the fertile time of the month is. So really you want to be having sexual intercourse around the time that you ovulate. Now, sperm do hang around in the reproductive tract for about 5 days. So long as you're aiming to have regular intercourse every other day from the day 5 days before you ovulate until 1 day after, because your egg will only last for 1 day before it is no longer viable. And generally, if you think about your cycle, most people have got about a 28-day cycle, and you ovulate 14 days before the end of your cycle, or the first day of your last menstrual period. So if you have a 28-day cycle, that would be day 14. If you have a 30-day cycle, that would be day 16, where day 1 is the first day of your menstrual cycle. So that's just a way to figure out when you should be having intercourse to optimise the chances of you conceiving. So in summary, we've covered the lifestyle factors that you need to consider. I've talked to you about why you need to book in and see your GP before you get pregnant. I've talked about the screening test that you will have done when you see your GP. We've talked about the importance of folic acid supplementation, and we've talked about when to have sexual intercourse in order to optimize your time, your chances of falling pregnant. So I'd really encourage you to visit my website, drsarahmoore.com, and please subscribe to my blog, This Doctor's Life, and you'll receive a regular monthly newsletter with similar information to what we've covered today. Thanks very much for joining me.